Make a big difference?
Well, it's going to make a difference for health overall. So all of the health problems that people normally have in a city, all the people who need regular medication for diabetes, or people who have heart attacks, or babies who are being born, that's all been going on, the same as always the past month. As the health system has focused so heavily on coronavirus, some of those routine health issues maybe haven't gotten the attention that they needed. By bringing in the surge capacity of more medical professionals, more beds for patients for coronavirus specifically, that will help coronavirus, but it's also going to help the overall health that we can get back to regular medical services.
And then one of the things I was just thinking as you were saying that, I may not be feeling well. Do I really want to go to the hospital? I might end up with this. If it's kind of quarantined in another area, you might feel more comfortable going and getting medical.
Right. So we want to make sure that people who don't have coronavirus don't pick it up at a healthcare center. Right. So separating out people who are confirmed cases from everybody else is going to help to slow this chain of transmission.
I remember the CDC news conference. One of the things that struck me was they were complimentary of China, not just on containment, but mitigation. What are some of the steps that you're seeing that surprise you or that you're happy about that can actually kind of limit the scope of this traveling? It is traveling, obviously, elsewhere, but you've got to kind of try and get a bottleneck on it, don't you?
Right. So the travel restrictions in Wuhan went into effect about a week and a half ago. So given a up to 14-day incubation period, we are just now going to begin to see that the number of cases outside of Wuhan slows down because those travel restrictions went into place. So all of these decisions, we're not going to see the effect right away, but when we look 2 weeks out, 3 weeks out, we're going to start to see that the measures that were put in place a few weeks ago are having the desired effect of slowing this down.
We saw Roy at Dulles. They've got these certain airports. Is that the right way to respond for the United States?
CDC has protocols in place that they work very hard on to develop and update regularly. So when something like this happens, there is a starting point for knowing how to try to make sure that we aren't getting that sustained local transmission in the U.S. Some of the things with the legal quarantine, where instead of people volunteering to self-isolate are being told, no, you will be under legal quarantine, that is an extreme step, but I think there's a perception that this is a situation that calls for some aggressive public health measures.
Yeah, I know you were just on the heat. This is ground that was covered on there, but Anand asked about the economy, and I was struck by this. Oil prices fell 2% today, lowest mark in more than a year, and a lot of analysts predicting that, people are going to be stuck in their houses. They're not going to be driving, and that you might see actual oil plummet by about 20%. Macau's casinos, they're going to take a hit. People aren't going to go out to these public ventures. Tourism, travel. What about the economic ripple effect of something like this?
All of this is guesswork, just as the epidemiologists are trying to guess how big will this go. Will this spread to other countries? The market folks are trying to do that same prediction of saying, we anticipate based on our models that this could spread in this way. So right now the economy is concerned. We will see whether that changes as the epidemiologists change their forecasts. But it's all still a guessing game. And
fortunately, you're not on Wall Street. You don't have to do that guessing game. But you have to do the other guessing game. So what is your take on what we're seeing now? I mean, what are you looking to in terms of numbers and where they move and that sort of thing? Because there is a science to actually watching all of this.
There is. So we were surprised, we meaning epidemiologists, last week when we saw the number of cases increasing so quickly. That was bigger than the models had predicted we would be detecting that soon. We have not seen the number of deaths increase at the same rate as the number of cases. So that's a good thing to observe, that the case fatality rate looks to be lower. So it's more contagious, but maybe less fatal. We also have not yet seen these sustained transmission chains outside of China. So we've got a lot of travelers from China infected in other countries. A few of those people had contacts that became infected, but we aren't seeing the sustained local transmission yet. That is a very good sign. That could still happen. We maybe just haven't detected that, but so far the spread outside of China has been slower than many people thought it would be.
I have a friend of mine who's in town from China, and he was talking about the apples and oranges, these comparisons with SARS, and I imagine you probably feel much the same way. Very annoyed, like this is only just the start of this, and SARS, it was much later that we got all these numbers. Are there lessons from SARS? I mean, or are you also kind of annoyed that they're kind of mixing all of these together?
SARS is our base model mathematically. That's the best model we had for how this would spread. As we get more data from coronavirus now, we will be able to make that model stronger. So it's a starting point for our best estimates, but it is certainly not the ending point for what epidemiologists do.